Hey guys, my name is Jordan Cohen. I chose the sport of soccer, and what I'm going to be telling you guys about is three main injuries that go into soccer and assessments and the anatomy of each specific injury. So I chose soccer because I've been playing soccer ever since I was 6 years old. I understand the game, know how it's supposed to be played. I've gone through numerous injuries throughout my whole career in soccer, including some of the injuries I'm about to show you in this presentation, and just know the correct assessments and the anatomy of each of these injuries. Um, there's different environmental factors that can go into soccer. You can play in the sun, rain, or snow. You can play in almost all conditions. In the sun, this can affect by leaving your muscles being very fatigued, and you can have to go into muscle cramping, and this can ultimately lead to like a hamstring strain or hamstring tear that can occur by playing in these conditions and the hot weather. Next is the rain. In the rain, it makes a good pitch turn to a poor pitch, and makes it less traction. You can end up turning and cutting and leading to an injury, which could ultimately be an ACL tear, as I'm about to discuss, because I've seen ACL tears happen in the rain numerous times playing in my career, and especially people on my team. And unfortunately, it happened from just cutting or even through a contact injury that happens in the rain because the guy was sliding and did not miss the ball and end up hitting his leg. Last condition is the snow. Snow again makes it from a good pitch to a poor pitch. It does happen. It is very rare, but injury that has happened there is the ankle sprains. Ankle sprains not only happen in the snow, but it happens in rain or sun too, through contact and no contact injuries. So anyways, guys, let's get started. Sorry about that. So the first one is a sprained ankle. This happens when one or more of the ligaments of the ankle is torn or partially torn. Mechanism of the injury is sprained ankle can occur when there is a combination of plantar flexion, an inversion, or eversion, which is very rare, and that's through contact or no contact, as I've said before. Example shown to the right, where the player is dribbling with the ball, seems to touch it forward, and the defender seemed to go for the ball but missed and happened to cleat his ankle, creating that inversion sprain and damaging the ligaments inside there. Anatomy of this is sprained ankles resolve an inversion or eversion twist. As you saw in the last picture, it's from an inversion twist that damages or tears soft tissues and ligaments. So the most common injury is from inversion sprain that affects many ligaments like the talofibular, calcaneofibular, posterior talofibular ligaments that are all on the inside of your ankle. This will cause swelling and pain, and you would not want to put pressure on these specific ligaments or any pressure on your foot exactly. An athletic trainer could treat this by the MICE method, checking the motion, getting ice on it, compressing it, and elevating it. So checking the motion of it is just changing the overall range of motion. What feels comfortable for the ankle? How far can it turn? Inversion wise, eversion wise, checking the dorsiflexion and plantar flexion. Overall, checking the mobility of the ankle. From this, you just want rest. Just resting, getting that ice on the specific area of the ligament, and you want to elevate it and compress it. So wrap that ice up, compressing it, elevate it. Probably want to get above your heart if you can, and just rest. What you want to do too is keep this ice on for 15 minutes on, 45 minutes to an hour off, and then repeat this motion for throughout the day. What I did mention earlier too is that it can happen from an eversion sprain as well, and that will affect your deltoid ligament on the outside of your ankle. But this is a very rare that you see in soccer, and not everyone gets it. Fortunately for me, one time in my career, I have received it and went through this RICE method and rehabilitated back properly. So, next injury is straining the hamstring. So, what straining the hamstring is an excessive stretch or tear of the muscle fibers and related tissues that are involved in it. Hamstring is on the back part of your thigh that has a semitendinosus, semimembranosus, and biceps femoris. Biceps femoris is on the outside of your thigh in the back. Semitendinosus is in the middle portion, and the semimembranosus is in the inner portion. Mechanism of injury is a hamstring strain can occur when you're sprinting for the ball and as the leg moves in eccentric action, so it's in that lengthening motion as you're sprinting. This can occur at the very beginning of a game because you just didn't warm up properly, or at the end of the game because your muscles are just so fatigued, which is shown here by Jozy Altidore on the right, who plays for the USA national team, as he happened to pull one of his hamstring muscles at the very end of a game during the World Cup. So anatomy assessment of it. The anatomy. A hamstring strain is a result of the muscle stretches to the point of tearing that, like I said, can be the semitendinosus, semimembranosus, or biceps femoris. What happens is these muscles are connected to your pelvis, and your lower end of your pelvis connects to ischial tuberosity in it. And from this, the tendon tears or partially tears away from it. That ends up creating swelling, being very tender to that area, and is very gentle. You just want to be very gentle with it. So as an athletic trainer, you want to feel around the area, to feel where a specific spot where the injury occurs, where the pain is. You can almost lengthen the muscle by pulling it up, stretching it, feeling how far the person could go in a stretch, and bending it as well, just checking the flexibility of the muscle. You want to check for swelling, bruising, tenderness, tightness, figuring out where that area is and how much pain that individual is in, so you can treat her in the right way that's supposed to be done. One last injury that occurs in soccer is tearing the ACL, the anterior cruciate ligament. Happens a lot in soccer and is one of the most common injuries, unfortunately, that happens in soccer. What this happens is the overstretching or tearing of the anterior cruciate ligament in the knee, which can be partial or completely. Most cases in soccer, it is completely torn. Mechanism of injury is an ACL can occur when there is a quick deceleration, hyperextension, or rotational injury that can involve contact with another individual, or it could be no contact, like in cutting and turning, like in soccer, with the soccer ball or even without it. But in this picture, as you see on the side, this person happens to fall on this man's knee, tearing that anterior cruciate ligament, also affecting those other ligaments around, like the LCL looks like it probably has affected, and even the MCL that could only tear as well along with the ACL. The anatomy and assessment of it is an ACL tear as a result of strong connective tissue that attaches bone to bone, and it can tear and it cannot stabilize the knee anymore. So what the ACL is just connective tissues that are in the front part of your knee that helps that run from the femur to the tibia, and tearing of this can affect, like I said, your MCL, your medial collateral ligament on the inside of your knee, or lateral collateral ligament that are on the outside of the knee that attach to it. And once this tears, it puts more stress on those ligaments that can only make them partially torn or fully torn as well. So tearing leaves the knee in a less stabilized motion, and it can no longer restrain anterior translation, which is one of its main uses as the ACL is. An assessment that an AT can do on it is assess just feeling around the area, checking the kneecap, putting in different movements like a posterior push, checking to see if that leg does move forward very easily, or if the knee does move forward very easily, and that there's no less stabilization that the knee can have. You want to check for swelling as well, see if it has swelled a lot or if it's even partially swollen. No matter what the swelling is, you want to see the individual's range of motion too by bending the knee, seeing going to where it does not feel comfortable no more, being very gentle, and then lengthening as well and seeing how much pressure can be put on her knee. But ultimately, an ACL tear, you're going to need surgery, and then you're going to need the proper rehabilitations to get back to it. So yeah, guys, there's 3 injuries: the ankle sprain, hamstring strain, and ACL tear that all happens in soccer and are 3 most common injuries, and there's anatomies and assessments of each injuries. Thanks guys for watching.